MHSRB ఎగ్జామ్ మాక్ టెస్ట్ అండి. కౌంట్ డౌన్ టు ఇంకా 2 డేసే మన ముందు ఉంది. సో ఇది మీరు మాక్ టెస్ట్ లాగా రాయండి. క్వశ్చన్ కంపల్సరీ ప్రాక్టీస్ చాలా అవసరం అండి. ఆన్సర్స్ నేను ఎక్స్ప్లెయిన్ చేయనండి, జస్ట్ ఆప్షన్ చదువుతాను, అదే ఆన్సర్ ఆప్షన్. తర్వాత ఈచ్ స్లైడ్కి 30 సెకండ్స్ ఉంటుంది. సో మీరు ఆన్సర్ జాగ్రత్తగా ఆలోచించి పెట్టండి. మిమ్మల్ని మీరు టెస్ట్ చేసుకోండి. లాస్ట్లో నేను కీ కూడా పెట్టానండి, సో ఆ కీ కూడా మీరు చూసుకోండి. ఇది ప్రతి ఒక్కరు రాయాల్సిన టెస్ట్ అండి, ఎందుకంటే ఇది MHSRB మాక్ టెస్ట్. సో వెల్కమ్ టు మై ఛానల్. స్టే సేఫ్, స్టే హెల్తీ. మీ ఫ్రెండ్స్కి షేర్ చేయండి, సబ్స్క్రైబ్ చేయండి. లెట్ us start the question. Which is the largest organ of the body? A. liver, B. brain, C. kidney, D. skin. It is option D, skin. The body of adult person weighs 60 kgs. Then total body fluid in him is A. 54 kgs, B. 48 kgs, C. 38 kgs, D. 28 kgs. It is option C, 38 kgs. The example of ECF is A. CSF, B. blood, C. interstitial fluid, D. all of these. It is option D, all of the above. The correct order of layers of epidermis from outer to inner side is A. corneum lucidum granulosum germinative, corneum granulosum lucidum germinative, germinative granulosum corneum lucidum, D. germinative corneum lucidum granulosum. It is option A. The cell from which human body develops is known as A. ovary, B. ovum, C. zygote, D. sperm. It is option C, zygote. The epithelial tissue found lining the urinary bladder is A. squamous, B. columnar, C. ciliated, D. transitional. It is option D, transitional. The epithelial tissue found in uterine tubes is A. squamous, B. columnar, C. ciliated, D. transitional. It is option C, ciliated. The endocrine gland which controls the functions of other endocrine glands is A. adrenal, B. pancreas, C. pituitary, D. thyroid. It is option C, pituitary. The bone is not forming the boundary of the cranial cavity. A. parietal, B. sphenoid, C. mandibular, D. temporal. It is option C, mandibular. The substance involved in inflammatory reactions is A. Renin, B. Histamine, C. Heparin, D. Thyroxine. It is option B, histamine. The volume of the voice produced by a man depends upon A. Length of the vocal cords, B. Force with which the cord vibrates, C. Shape of the mouth, D. Tightness of the vocal cords. It is option B. Force with which the cord vibrates. The number of polar bodies are released at the time of ovum discharge: A1, B2, C3, D4. It is option A1. The patients present symptoms at the time of acute respiratory failure: A. Hypercapnia, B. Hypoventilation, C. Hypoxia, D. All of these. It is option D. All of these. The parietal pressure of oxygen in deoxygenated and oxygenated blood respectively are A. 100 mmHg and 140 mmHg, B. 60 mmHg and 120 mmHg, 40 mmHg and 100 mmHg, 20 mmHg and 60 mmHg. It is option C, 40 mmHg and 100 mmHg. The lifespan of a sperm is A. 48 to 72 hours, B. 24 to 48 hours, C. 12 to 24 hours, D. 0 to 12 hours. It is option A, 48 to 72 hours. The congenital absence or closure of a normal body orifice or tubular organ is called A. Fistula, B. Atresia, C. Hernia, D. stenosis. It is option B, atresia. The largest volume of air which can be expelled from the lungs during maximal expiration is called A. Expiratory reserve volume, B. Residual volume, C. Inspiratory reserve volume, D. Tidal volume. It is option A. Expiratory reserve volume. The following tissue is widely and abundantly distributed in human body is A. Muscular, B. Lymph, C. Connective tissue, D. Cartilaginous. It is option C, connective tissue. The eating behavior in human beings is controlled by A. Pancreas, B. Hypothalamus, C. Thyroid, D. Pineal gland. It is option B, hypothalamus. The synthesis of glucose from fat is called A. Glycolysis, B. Glyconeogenesis, C. Krebs cycle, D. Saponification. It is option B, glyconeogenesis. Glenohumeral joint is also called A. Hip joint, B. Knee joint, C. Shoulder joint, D. Elbow joint. It is option C, shoulder joint. Which blood group can be administered to a patient in emergency when his blood group is not known? A. O negative, B. O positive, C. AB negative, D. AB positive. It is option A, O negative. The major constituent of the bone is A. Calcium sulfate, B. Sodium chloride, C. Magnesium sulfate, D. Calcium phosphate. It is option D, calcium phosphate. The protein factory in the human body cell is A. Nucleus, B. Cytoplasm, C. Golgi apparatus, D. Ribosomes. It is option D, ribosome. The posterior pituitary is mainly consists of A. T cells, B. C cells, C. Neuronal projections, D. Beta cells. It is option C, neuronal projections. Bell's palsy is a disorder of the cranial nerve. A. Ninth, B. Seventh, C. Fifth, D. Third. It is option B, seventh. Which part of the brain control the body temperature? A. Pons, B. Amygdala, C. Hypothalamus, D. Liver. It is option C, hypothalamus. The Adam's apple is formed by A. Epiglottis, B. Cricoid cartilage, C. Thyroid cartilage, D. Hyoid bone. It is option C, thyroid cartilage. Depolarization in a nerve action potential is due to A. Opening of potassium channels, B. Opening of sodium channels, opening of calcium channels, closing of sodium channels. It is option B, opening of sodium channels. The recommended flow rate of oxygen via nasal cannula is A 1 to 4 liters per minute, B 1 to 6 liters per minute, C 4 to 6 liters per minute, D 6 to 8 liters per minute. It is option A 1 to 4 liters per minute. The size of intravenous cannula used for neonate is A 24 gauge, B 22 gauge, C 20 gauge, D 18 gauge. It is option A 24 gauge. Which of the following is not a physician prescribed interventions? A. Drug administration, B. Ordering diagnostic test, C. Performing wound care, D. Elevating an edematous limb. It is option D. Elevating an edematous limb. The practice of nursing is regulated by A. State Nurse Practice Act, B. Institutional policies, C. Federal guidelines and regulations, D. International standards and codes. It is option A. State Nurse Practice Act. Kusumal breathing is associated with A. Atelectasis, B. Bronchial asthma, C. Diabetic ketoacidosis, D. Heart failure. It is option C. Diabetic ketoacidosis. Rhythmic waxing and waning of respiration is called A. Hyperventilation, B. Hypoventilation, C. Orthopnea, D. Chinese stroke respiration. It is option D. Chinese stroke respiration. What should be the size of the endotracheal tube for a newborn weighing 2 to 3 grams? A 4.0, B 3.50, C 3.0, D 2.50. It is option B 3.50. Clinical death is also known as A. Biological death, B. Brain death, C. Legal death, D. Accidental death. It is option B. Brain death. Treatment of severe dehydration is A. Start DNS immediately, B. Start colloids immediately, C. Start ringer lactate immediately, D. Combination of 5% dextrose with ringer lactate immediately. It is option C. Start RL immediately. Common complication after perforation of appendix: A. Hemorrhage, B. Peritonitis, C. PID, D. Intestinal obstruction. It is option B, peritonitis. Linear burrowing of a mite at finger webs, wrist, elbow, ankles, and penis is seen in case of A. scabies, B. impetigo, C. psoriasis, D. herpes zoster. It is option A. scabies. Deep vein thrombosis renders a person at a risk of A. pulmonary embolism, B. shock, C. stroke, D. heart attack. It is option A. pulmonary embolism. CPR and defibrillation should be initiated in a kind of arrhythmia: A. atrioventricular block, premature ventricular contraction, C. atrial fibrillation, D. ventricular fibrillation. It is option D. ventricular fibrillation. Severe dyspnea, orthopnea, paler tachycardia, and frothy blood tinged sputum is seen in A. left heart failure, B. right heart failure, C. pulmonary edema, D. congestive heart failure. It is option C. pulmonary edema. An early manifestation of laryngeal cancer is A. stomatitis, B. hoarseness, C. dysphagia, D. airway obstruction. It is option B. hoarseness. Paradoxical respiration is most commonly seen in A. Flail chest, B. obstructive airway disease, C. cardiac tamponade, D. congestive heart failure. It is option A. Flail chest. An early indication for development of hypocalcemia is A. memory changes, B. tingling sensation in the fingers, C. ventricular dysarrhythmias, D. depressed reflexes. It is option B. tingling sensation in the fingers. The lifespan of human platelets is A. 10 to 12 minutes, B. 10 to 12 hours, C. 10 to 12 days, D. 10 to 12 months. It is option C. 10 to 12 days. The lifespan of human RBCs is A. 120 minutes, B. 120 hours, C. 120 days, D. 120 months. It is option C. 120 days. The human blood cells are enucleated: A. RBC, B. WBC, C. platelets, D. both RBC and platelets. It is option D, both RBC and platelets. A patient with liver fail have edema is most likely to receive A. Diuretics, B. Laxatives, C. Antidiuretics, D. Beta blockers. It is option A. Diuretics. The drug of choice for methylene resistant Staphylococcus aureus: A. Clindamycin, B. Vancomycin, C. Erythromycin, D. Gentamicin. It is option B. Vancomycin. Which of the following anti-tubular medication has the side effect of peripheral neuritis? A. Pyrazinamide, B. Isoniazid, C. Rifampicin, D. Ethambutol. It is option B. Isoniazid. A patient came to ED unconscious with pinpoint pupil, lacrimation, and history of substance abuse. Which drug to be administered to him? A. Naloxone, B. Lorazepam, C. Flumazenil, D. Naltrexone. It is option A. Naloxone. A patient with DVT is advised low molecular heparin. At which site the nurse should administer this? A. Oral, B. IM, C. IV, D. SC. It is option D. SC. Which drug may cause grey baby syndrome? A. Chloramphenicol, B. Gentamicin, C. Penicillin, D. Tetracycline. It is option A. Chloramphenicol. Which of the following is not side effect of salbutamol? A. Muscle tremors, B. Sedation, C. Palpitation, D. Nervousness. It is option B. Sedation. Which is the drug of choice for severe and complicated malaria? A. Quinine, B. Artesunate, C. Primaquine, D. Chloroquine. It is option B. Artesunate. Antidote for heparin is A. Protamine sulfate, B. Vitamin K, C. Aminocarpic acid, D. Aminodarone. It is option A. Protamine sulfate. The values of correlation coefficient varies between A minus 0.52 plus 0.5, B minus 0.75 to plus 0.75, less than or equal to minus 1.0 to greater than plus 1.0. D. None of this. ఇది రీసెర్చ్ క్వశ్చన్ అండి. It is option C. The constant presence of a disease or infection within a given geographical area is called A. Sporadic, B. Epidemic, C. Endemic, D. Pandemic. It is option C. Endemic. Koplik spots are clinical feature of A. Chickenpox, B. Pertussis, C. Cholera, D. Measles. It is option D. Measles. Which of the following is not constituent of vital statistics? A. Birth rate, B. Morbidity and mortality rate, C. Educational rate, D. Life expectancy. It is option C. Educational rate. Route of administration of PPD for tuberculin test: A. SC, B. ID, C. IM, D. IV. It is option B. ID. The first referral level in the healthcare system is A. Primary healthcare, B. Secondary healthcare, C. Tertiary healthcare, D. Primordial healthcare. It is option B. Secondary healthcare. Housefly is responsible for spread of A. Diarrhea, B. Dysentery, C. Cholera, D. All of these. It is option D. All of these. When did the Mental Health Bill become Mental Health Act? It is option C. 1987. A freshly prepared ORS solution should be used within A. 24 hours, B. 48 hours, C. 12 hours, D. 6 hours. It is option A. 24 hours. Ripeness of cervix is assessed by A. Bishop score, B. Apgar score, C. Downey score, D. New Ballard score. It is option A. Bishop score. Uterus is palpable at the level of symphysis at A. 8th week, B. 10th week, C. 12th week, D. 14th week. It is option C, 12th week. Normal duration for involution of uterus is A 2 weeks, B 4 weeks, C 6 weeks, D 8 weeks. It is option C, 6 weeks. సో ఇక్కడ మీకు ఆన్సర్కి ఇచ్చానండి. మీరు కావాలంటే డౌట్స్ ఏమైనా ఉంటే చూసుకోండి. సో ప్రతి ఒక్కరు ప్రిపేర్ అయ్యారు అనుకుంటున్నాను. దీంట్లో 1 to 70 క్వశ్చన్స్ మాత్రం నేను చేయగలిగాను. తర్వాతది పార్ట్ బి ఉంది, అది కూడా ప్రాక్టీస్దే. మీ ఫ్రెండ్స్కి షేర్ చేయండి. తప్పకుండా ఈ టెస్ట్ని మీరు అటెంప్ట్ చేయండి, ఎందుకంటే మీకు ప్రాక్టీస్ అనేది అవుతుంది. కేవలం వింటే మాత్రమే ఆన్సర్స్ గుర్తుండవండి. ఒకసారి మన మైండ్తో మనం ఆలోచించినప్పుడు తప్పకుండా మనం రాయగలుగుతాము. సో ఈ బిట్స్ని అస్సలు నెగ్లెక్ట్ చేయొద్దు. మ్యాక్సిమం మనం అన్ని సబ్జెక్ట్స్ కవర్ చేసాము. స్టే సేఫ్, స్టే హెల్తీ. డోంట్ ఫర్గెట్ టు సబ్స్క్రైబ్. మీ ఫ్రెండ్స్కి షేర్ చేయండి, సబ్స్క్రైబ్ చేయండి, లైక్ చేయండి. అందరికీ నోటిఫికేషన్స్ వెళ్ళి చదవాలి అంటే మీరు లైక్ చేయాలి. థ్యాంక్ యూ.